Well, hello and welcome to HIPAA Chat. I'm Carol Fly with High Tech Answers. Thanks for joining us today. We host HIPAA Chat on a monthly basis, so if you're new to HIPAA Chat, sit back, relax, pose a question for our experts, and along the way learn something about HIPAA compliance. That's what we are talking about today. What does it mean to be HIPAA compliant and how do you get there? HIPAA Chat is sponsored by eFax Corporate, branded J2 Cloud Services. They've been our sponsor from the get-go, and without their support, HIPAA Chat would not be possible. Please visit them online at enterprise.efax.com. They have a number of products to help with the secure transmission of ePHI. You can also check out HIPAA Chat on LinkedIn. We have a group there as well where you can pose a question and have a number of experts hanging out in there answering questions in a discussion group. You can find past HIPAA Chats on our two YouTube channels, one under High Tech Answers and the other under Healthcare Now Radio. We repurpose HIPAA Chat as a broadcast on our internet radio station, and you can stream that live at healthcarenowradio.airtime.pro. And of course, our experts are from the Compliancy group. You can stump the experts, or try if you can, by posing your question on the right side of the dashboard. If during the course of HIPAA Chat you need to reach out to our experts or post-event, please email Bob Grant at bob@compliancygroup.com. She's Strategy Officer at Compliancy Group, and Marc Haskelson. He's the president of the Compliancy Group. Bob, Marc, thanks for joining us back on another HIPAA Chat. We're glad to have you here.
Well, Carol, thank you, and thanks to High Tech Answers and eFax for letting us participate. We definitely have fun with it.
Yeah.
All right, so
I'm going to go on
what does it mean?
And I'll see you at the end.
You got it. All right, so what does it mean to be HIPAA compliant? There is so much darn misunderstanding. So Bob, to make life interesting, you want me to throw up one of the, let me start off with the first couple of questions. And then folks, please do post them. This is, you know, Bob and I are used to tangling with each other all day long, so it makes it more fun when we get to have debates with other folks. So the first big question which was sent to us was, and this is one Bob, when you get it, you're going to laugh because we hear this all the time. Who designates if you are HIPAA compliant?
Huh, that is a good question. Well, what designates if you're HIPAA compliant or not is if you have enough documentation that cover the regulations set forth by HHS and the federal government, meaning by regulation. So there's regulations, there's 164-300s for security, 164-500s for privacy, there's the 164-400s and 13,000s for breach notification and high tech. So each one of those regulations have a standard, and you must have documentation to show that you're meeting that standard. So if the federal government shows up, or the state, or the Attorney General, or whoever, you need to have the documentation to show that you are HIPAA compliant based off those standards. So that's what Bob, we're talking about today. Yeah.
So if someone had those standards, do they get a credential for being compliant? Do they get an actual certificate?
There is no certificates. There is no governing board. There is no person that can tell you that you're HIPAA compliant. There's only the standards that you go by, and even in the rule it says there is no certification process for HIPAA compliance. I think what they wanted to do was make sure that they didn't have people saying that you could be HIPAA compliant by doing this process when they want you to follow their process.
Cool. All right, and the next question that was related, or next part of that question was, okay, so if I'm not compliant, will I be fined?
Depending on the level of deficiencies that you have in place. Let's say you did some of it, right? You got a half-baked security policy that you think covers everything, and your privacy policy is the same, and maybe you did an audit or two, but you really didn't follow through with fixing everything. Yeah, you're going to get fined. If you didn't do anything at all and you've never done anything and you don't have any policies or procedures on it, yeah, you definitely will get fined. And the fines will start for you. It depends on the level, right? If you made a good faith effort and you have policies and procedures and you have your audits and your people are trained and everything is as best as you could possibly do it, and they find one or two things wrong, your fines are going to be probably $100. But if you're the other guy on the other end where you stuck your head in the sand and said, they're never going to audit, they're not going to find me, yours is going to start at $50,000 and it's $50,000 for each thing they find. So it's either 100 or it's 150,000. You pick it's kind of like you picking and choosing what kind of fine do I want. Do I want a slap on the hand, or I'm just going to just pay it, which most people can't. Because if they find 10 things wrong at $50,000, you got $500,000? You got $500,000 you can just give to somebody? Probably not. And let me tell you something. Let's say you say, I'm going to close my business. I'm going to close my business, right? You're still going to face that fine. It's kind of like taxes. Can't get away from them unless you're going to die.
That's a little harsh there, Bob. Don't die on me.
Well, I'm just
okay.
Just making a point.
So now, next question. When a vendor says our product is HIPAA compliant, what documentation should we be asking for?
Oh, that's a good one. So, you as a covered entity, right? When you're dealing directly with patients and things like that, you have one set of standards. Well, you have three set of standards you have to comply with. You have to comply with privacy, you have to comply with security, and you have to comply with breach notification high tech. Great. A business associate has to comply with three of the things. They have to comply with security, well, really two, security and breach notification. So they don't have to do privacy because they don't see patients, but they have to have all the security protocols in place. So what you should be able to do is, and if you haven't done this already, you need to have a business associate agreement in place with them, an up-to-date, true business associate agreement, and you should audit them. If they say they're HIPAA compliant, then you should be able to get, what did you do to be HIPAA compliant, right? You should be able to audit them. And if you haven't audited them, it's kind of like giving your car to some guy who walks by and says, here, take my car for a drive. You don't know what the guy's going to do with it. Same thing with your data. You give it to a BA. If you don't have that documentation, you don't know what they're doing with it.
And I tell you, one of the things that we often see, which is confusion around this, is, and Bob, maybe spend a few minutes talking about what really should be in a BA agreement. I mean, what's the minimum requirement of a business associate agreement?
Well, the minimum requirements for a business associate agreement is online at HHS, but you should have your business associate agreement should have, and hold on one second, the business associate agreement should have, number one, well, the two companies, right, what you're doing. It should have you should have the necessary documentation that says what they can and can't do with the data. So by having the necessary documentation of what you can and can't do with the data, they actually sign that and say so they can't share it, they can't market to it, they can't do all of that type of things. And so then you, on that point, you have them in a standard, in a hardcore agreement that makes it HIPAA compliant. So the same things you can't do with it, unless you get an authorization of disclosure, is the same thing that they can't do with it. And then also stating that they have to be HIPAA compliant. So that business associate agreement is extremely important, and it's one of the first things they ask for when you get audited. They're going to ask for all the people that you're sharing protected health information with and the business associate agreement. Oh, well, we really don't know, and we don't have an agreement, so I don't know what you're talking about. Right? Well, here's your fine. So that business associate agreement, which has the obligations, it has the terms and termination, like let's say you want to get out of this agreement. Well, you need to have terms in there that says, okay, if I get out, you're going to destroy my data. You're not going to keep it and have it in some of the, you're going to destroy my data. And that business associate agreement protects you, because let's say they don't do it, right? This business associate agreement down the road may save you if they have a breach and your data got breached, even though you told them in the business associate agreement to get rid of it. So it's not, when we say business associate agreement, it's more of a contract. It's actually a contract that directs the business associate agreement how to handle the information that you're sharing with them.
All right. So next one. Sorry, I'm just jumping around here. Proper policies and procedures are in place. Okay. Sorry, I'm just trying to put these questions together on something. How does a BA comply with privacy policies if you never deal with patients ever? We just provide an IT tool to a covered entity. This one's an interesting misunderstanding, which Bob will explain, I'm sure.
One more time?
Okay, so the question was, how does a BA comply with the privacy policies if you never deal with parties? So privacy rule versus security rules. So yeah, you don't have to.
You don't have to, right? So you should have some privacy in place if you ever release information, but if you're not, if you're just providing a tool and you access that tool maybe to do support, right? You should have security policies in place. You should have breach notification policies in place, but you don't have to have privacy policies in place. It really depends on what the BA is doing. I shouldn't say that all BAs don't have to comply with some privacy policies, because sometimes they do. Sometimes they are sharing data with others, right? So think of the covered entity and the business associates as a chain, right? It's one long railroad trip, and each one of those little pieces of wood inside is one of the cogs of this chain, okay? So you got the first chain is the covered entity, and then the covered entity has a business associate, but that business associate may have a business associate, and that one may have one. So if you're 10 links down, the covered entity is not responsible for that 10 links down. It's the business associate in front of them. So the business associate may have to have business associates. And that's some things that business associates don't understand. So the business associate signs contracts with the covered entity and they think they're done. Even though they've got 6 or 7 people, they've got a clearinghouse, and they've got other things that they're doing too. They're storing data off-site. So you have to make sure that when you're doing this, that you as the business associate may have people you're sharing this covered entities and multiple covered entities data with. You have to have a business associate with them. So you have a business associate agreement with everyone, and then those 5 would have, so you could see it would grow as you go down the line. But you know what? That's what the government thought. I'm going to say right now, it probably is not happening. And
well, I think one of the
things
that
are going to happen. So,
yeah, it's interesting. A lot of people, the world of BA enforcement is definitely up, and this is just a commentary. Since we're talking about what does it mean to be HIPAA compliant, you saw close to $7 million in fines to covered entities in just the month of April, around. And almost all of them were around not having proper BA agreements in place. So understand it, technically under the law, under the rule, you're not allowed to give any information to a business associate if you don't have a BA agreement in place first. So this isn't one of those things that's optional. You really need to get there, and you want to get there as quickly as possible. So well, interesting. It's funny, this event and last event we got lots of questions about BAs and the new worlds of what we're seeing in enforcement. Here's a question that Bob, I see often that may be more security related, but I'm curious to see how you take it. What does it mean to be HIPAA compliant in the cloud? Sorry, it's a stump.
If you're a cloud vendor?
Well, the question wasn't asked that way. It just said HIPAA compliant in the cloud. So I'd recommend answer it from the perspective of a covered entity and they have, let's say, a cloud-based EHR, and then what is a software provider or a BA that has a cloud-based service, what those two differences are.
All right. So let's go with the covered entity to the cloud. And I hear this all the time, right? Oh, I don't really have to do this because all my data is in the cloud and it's protected. Great. I'm glad all your data is in the cloud. Is all your data in the cloud? Really? Every bit of it? all the documentation, all your connections to every computer is not storing any type of data. Usually that's not true in any healthcare organization. There are the laptops, the desktops, and things like that inside your site. You've got people in billing who are writing letters to the insurance company to try and get paid, or to another doctor, or to a patient. And everything that's on there, that's in that computer, that's in your office, is not in the cloud. And that data that's on there, if that hard drive or that laptop or that workstation gets stolen, that's a breach. So when people say everything's in the cloud, and even if everything's in the cloud, let's say it all is in the cloud, you're still connecting to it. And when you connect to it, you still have to have a device audit, you still have to have a risk analysis, you still have to have privacy policies, and you still have to have security policies. Just because your stuff's in the cloud doesn't mean you get out of jail card free. You don't. Now, you're the company that has the stuff in the cloud. You still have to be security compliant. You still have to have all the security policies. You still have to do all your audits. You still have to train your staff. And just because you're in the cloud doesn't mean anything, really. It just means that most of my data is being protected somewhere else, meaning they're encrypting it, they're storing it. That's just one part of the compliance plan that I don't have to deal with. That's fantastic. But that doesn't give you a get out of jail card free and say that you don't have to do the rest of this. You still have to do all the rest. And that's where people get confused, because these people who are selling them the stuff are telling them that. They're giving the inferences that if you do it with us, it'll make your compliance so much easier. And so when the person hears that, they think, well, great, I don't have to do this. They don't question it. So you still have to have all the documentation. And people are going to find out really quickly here, because, like I said, we've had 8 of our customers have been audited, or have started the audit process, right? And here the stuff is coming out from them, and it's starting to come out more quickly than I thought it would. And so people are getting these audit things, and they're sitting there and they've got nothing. Our customers have all their documentation. These people have nothing. And they're going to face huge fines, and you're going to see it start to come up in the paper real quickly. I'm thinking about the July, August, September, right in the middle of summer. You're going to see articles coming from HHS that are going to just turn healthcare on its ear, because all these healthcare providers, small, medium, and large, are going to see huge fines being levied. And there's going to be a panic in healthcare. I mean, I guarantee it. I said it would happen sooner than, because when we first started this company, I said that it was the matter of time before this would happen, that they would start auditing everybody like they did the banks for GLB. And my prediction's coming true. It's coming true later than I thought, but it is starting to come true, and you're going to see a big push, because HHS is getting really, really pissed off.
Yeah, that's because, Bob, you're like the crazy drunk uncle from Saturday Night Live in a corner. That's all.
I am. Exactly. But let me just say one more thing, Mark. HHS is getting pissed off because they've given 10 years, 11 years now for people to become compliant, and they've just buried their heads in the sand. And so they're not going to do it either.
And on that note, for those of you who follow Jocelyn Samuels, who is in charge of enforcement, she's actually, I forgot the exact quote, but her quote went something along the lines of, you've had 9 years to be educated. This is now about enforcement. So it's definitely, let's not spend this all the time just scaring you guys, but being compliant, I still believe, and Bob and I are both pretty passionate about this, is can be a very positive, improve the quality of your brand and differentiate you in the market if you do it correctly. Don't just think of it as, this law that I have to satisfy to avoid getting in trouble. Think of it as, by doing it, you're showing your patients, your clients, that you take their privacy very seriously. And there was some data points I was reading about that. This is reported by consumers in the market. And what they had said was 68% of them felt that their medical provider was not capable of protecting their PHI, that they were not confident that we as an as a community were capable of protecting their PHI. And in the case of people who had identity theft, 53% of them said that they thought their identity theft originated out of a healthcare issue, not off of the other areas. There are lots of other, banks, stolen records, etc. So the average consumer is getting a little bit smarter about this. Let's do one more on the BA thing, and then we'll try to get to some of the other interesting questions. So does the covered entity need to verify the existence of a business associate agreement that as a BA has with others, or is it enough to require it in the contract? What happens if the BA should have had a BAA and did not? Can the covered entity be liable?
Okay, that's a good question. So if you have a BAA, a really good BAA in place with your, so you're the covered entity and you have an ironclad BAA with your BA, which will state in there that they must have, a BAA with other BAAs, and they need to be HIPAA compliant. Just them being HIPAA compliant will tell the BAA that they need to do that, okay? Once that BAA agreement is in place, you're responsible for that BAA. I just explained that. You're responsible for that BAA. If that BAA has other, they're responsible. And if something happens down the chain, not your fault. Your responsibility was that person that you're directly connected to. If something happens behind them, it's that BAA's fault. He has to rectify the problems then, not you. They have to alert you that it happened, right? That's what the BAA says. If anywhere in the chain there is a breach, you're to be alerted, but you don't have to do anything about it, right? You just have to monitor it. So the BAA that's below you, whoever the next BAA is was in the chain, the one before where it happened, they're responsible for reporting. They're responsible for investigating, not you, right? You're to be alerted because, of course, the HHS may come and talk to you. Well, what kind of data did you send to them? Well, we sent this and that, whatever, a normal, process that we have in place with them. And they're just going to say, okay, great. Then they're going to go down and investigate the BA. So as long as you have the BA in place.
Yeah, so the only thing I would say that, well, I agree 100%. Bob is identifying it beautifully. Just be careful, because one of the things we're hearing in the phase 2 protocols is that if a covered entity fails, they have the right to fail the business associate. They have the right to audit the business associates, and the BAs of that covered entity. And if that BA fails, they'll have the right to audit the clients of that business associate. So the friends you keep does matter, but to Bob's point, you're only responsible for the relationship you have directly. All right, so we're getting lots of BA questions. Do you need a business associate agreement with an insurance company you file with?
I'm going to make this really easy for everybody. This is the easiest explanation I could tell you of what a BA is, okay? And so, and here it goes, right? A business associate is somebody that you hire, meaning that you pay them something to do something for you. Okay, I'll give you a chance to write that down. A BA is somebody that you hire, that you pay them money to do some type of work for you. And in the relationship of that work, the contract or whatever, you are either giving them access to or directly sharing PHI with them. And now with that, thinking about what I just said, who falls under that? Your EHR, your clearinghouse, your EHR clearinghouse, shredding company, sometimes your lawyers, sometimes your lawyers, sometimes your consultants, your IT company, your storage company, your malpractice insurance, right? You hire them to do something for them, and you're either giving them access to it or sharing PHI. Those are business associates. So that leaves out who? That leaves out insurance companies, labs, things, other hospitals, other doctors, because remember this, If it comes to treatment, payment, or operation, share away. Treatment, right? You're sharing with the doctor or hospital, referrals, things like that. Payment, insurance companies. Operations, the insurance company wants to come in and do a chart check. The state wants to come in. Anything that has to do with operations, you're doing malpractice or whatever, share away. You don't need an authorization and disclosure form. You don't need. So you don't need a BA with them, okay? But when it comes down, well, malpractice you do. But operations is like chart checks and things like that, okay? But anybody else, you hire them to do something for you and you share protected health information with them, BA. That should make it easy for everybody to look at your practice and go, they're a BA, they're call centers, things like that. So, any place like that, you'll know right away. Did I hire them? Yes. Do I share PHI with them? Yes. Business associate agreement. Perfect.
All right, so Bob, here's another detailed question, and this is an area that we're seeing more and more questions about. But I am a law firm getting medical records during discovery, and I have signed authorizations from opposing counsel signed by plaintiff. Do I need a BA agreement? If so, who do I need to get it with?
When you, as a law firm, if you have a signed authorization form from the patient, you do not have to have a business associate agreement. But if you're a law firm working for a doctor, and the doctor, and you're working on whatever you're doing with him, and they're sharing, he's got questions with you, and he's sharing PHI with you, then there would need to be a business associate agreement in place with him. But if you have the authorization, the disclosure form, meaning the patient knows that the data is going there, and you present that to the practice and they share information with you, you don't have to have a business associate agreement for that. Only in the event where you're hired by a doctor's office or a hospital and they're directly sharing PHI with you in discussions, then a BA would need to be in place. Because the patient doesn't know they're sharing the data with you. So you need a business associate agreement in place for it.
All right, here's one that's been coming up more and more. Do you think those offices that were audited for meaningful use will have a higher rate to be audited for HIPAA compliance?
It depends. I don't think it really matters about MU. I know MU was, would release the information of their findings to HHS, and I think that people who were severely deficient probably went on a list for HHS. I can see that happening. But the way that HHS has explained it is, it's arbitrary. So they were just picking and choosing names. But then again, I don't know. I'm going to assume that people who were deficient in MU, because they did say that they were sharing that information with HHS, will be on the list to be audited by HHS.
All right. So let's ask a couple of different kind of questions. So here's one. Is a remittance advice sheet under HIPAA? I'm sorry. What does it mean? I'm sorry. Sorry, make sure I read this correctly. Is a remittance advice sheet under HIPAA ? The sheet that comes from an insurance company line item listing the payments made, name of client, service code, etc. So does that fall under HIPAA?
Absolutely.
Beautiful.
All you have to have, and now this just came out recently. For many, many years, people would say, what actually is protected health information, right? People would say, well, is it name and diagnosis? Does it have to have medical information in it for it to be PHI? Well, they just made an announcement a couple of weeks ago that I read to where PHI could be as simple as a name. There's 18 fields, and those 18 fields all are considered PHI. Every one of them, every field. So if you look at the 18 fields of HIPAA, and if you don't know what they are, look them up. Just look up on your browser 18 fields of HIPAA. They will give you a whole list of what is considered protected health information. And one of the things that they talked about was one simple field could be considered PHI. So when you just said that you looked on there and you've got payments coming back, which I'm sure are attached to diagnosis codes, and then you've got the name and you've got an address, you've got PHI, and those need to be protected. So if you're getting them back from the insurance company, you either need to shred them or scan them and shred them, but you need to shred them. If they're coming electronic, you need to, dispose of them properly. Next question.
All right, let's see. Any tips on simplifying the request form when there are requirements for substance abuse records? Patients may have both medical and substance issues and may or may not be in a psychiatric unit. It's a real detailed one.
Oh, you just crossed 4 regulations just in one question. So you must have a policy on psychotherapy notes, which when you can release them, when you can't release them, right? Which usually if you can't release them, right? You can't even release them to the patient, right? You have substance abuse, which, okay, well, let's talk about this too. Is this a minor? Because minors in most states have certain rights when it comes to substance abuse and pregnancy and STDs and birth control. So, is it a minor, right? So you need to have a minor's rights policy. You have to have a authorization and disclosure form, right, detailing what they want to release and who they want to release it to, and you need it signed by the patient. You also need a policy on release of information. Do I need an authorization disclosed, or can I just release it, is it treatment, payment, or operations, right? So you crossed 4 regulations. You crossed multiple regulations, and I can think of 4 policies that you should have in place covering all of that. If you don't have the policies covering all that, then if you were to release information erroneously and they came and did an audit, they would fine you because you didn't have the proper documentation to direct your staff on what to do. They didn't make this easy for people. I'm just going to say this right now. I just want to make a comment here to everybody. There's no simplified way to do this. They didn't make it easy. And plus, they didn't make it easy on the 1 and 2 doctor practices with 5 to 10 people, right? They basically did not make HIPAA light. They made one set of regulations that are very complicated, and there are some people out there that will, tell you that you have to be, you've got to do all this work, and you're just a 1 or 2 doctor practice. And remember this. Going back first, let me finish my thought. So they didn't make it easy on you, okay? There are about 30 policies you have to have in place, even if you're a 1 to 2 doctor practice, to cover you if you're audited, okay? You also have to have the training involved, whether it's HIPAA 101, fraud, waste, and abuse. You need to have some training in place for your staff too. It's not easy. It's not an easy process, and to get it done right, you're going to need somebody to help you, okay, if you're that small. Now, the larger you get, the medium size, I see a lot of good things in medium-sized clinics and things like that. They have a lot of it in place. They don't have all of it in place, but they have a lot of it in place. And then the larger you get, it's like you're dealing with a 1 to 2 doctor practice, seriously, because they're so big and it's so hard. And then you turn around and it looks like they're a 1 doctor practice. So, it's everywhere in between here. So is it easy? No, it is not easy. But the one thing that I want everybody to know too is that if you spend a little bit of time, the next years become easier. Because once you have the policies and procedures in place, unless the rule changed, and it hasn't changed, and it's not, in my opinion, it's not going to change, because how can you change the rule if you're doing audits? Can't do it. You can't change the rule and expect an audit to come through and for you to be compliant. So they're not going to change the rule right now. They won't. They can't, because they're doing these audits. So if you have your policies and procedures in place and you have your training in place and you do it every year, you will be able to show due diligence. I want everybody to understand this too, is that if you look at the rule and you read all 578 pages, it doesn't say you need to be compliant. It doesn't say anywhere in there that you need to be compliant. What it says is you need to make a good faith effort. Well, what the heck is that? What is a good faith effort? What does a good faith effort look like? You know what it looks like? It looks like you've got all the policies covering all the regulations. It looks like you've got training in place. It looks like you've got your staff trained. It looks like you've done your IT audits, risk analysis, device audit, physical site audit, and you have closed as many loopholes as you can for somebody to get information. That's what due diligence looks like. Does it look like you're compliant? Absolutely. But if you don't want to face a fine, you want that all in place. If you don't have that in place right now, you better start working fast because they're coming. Okay, I'm off my soapbox now. Go ahead, Mark. Mark, did you mute me?
Sorry about that, guys. I did mute you. Okay. Sorry, Bob. This does relate to your rant. Okay. Not to contribute to it, because I know you can get crazy. In the case of an audit, I thought that if a practice demonstrates reasonable effort to become compliant by doing a risk analysis, and they have a reasonable set of policies, they may be asked to correct some situations that may have been missed. If they don't conform, they will then be fined. You indicate that if anything is found during an audit that does not meet all of the requirements, a fine will be levied. Is that the case?
Okay, as I just said, right? Now you have to understand this too. When you say, right, that if I make a good faith effort, right, and they come and they do this audit, right, and they find that I've made a good faith effort because I've made, you know, I've done some things, right? Do you really want to put your practice in jeopardy based on what they are going to say? That's my whole point. So what you're telling me is I'll just go through and do a few things, and I hope in your mind you say it will, but I know you're saying I hope that I'm found to be making a good faith effort. But did you really make a good faith effort? Right? You said I had some of the policies, I did a couple of audits, and I did a little bit of training, and is that really a good faith effort? They're going to say no. So it depends on what you think a good faith effort is and what they think a good faith effort is. That's the whole point of the message, okay? And all I do, and every day what I do is try to protect people. And you have to remember this. If you are sitting on here and you were assigned the security officer or the privacy officer or the compliance officer, you're also looking at problems for yourself. So saying that I'll do this and I'll do that. No, the one thing you should be saying is we are going to be compliant as I possibly can make us. We'll have policies covering all aspects of the rule. We'll have training. We'll have our audits. And then if they find something wrong with that, well, then I'll make changes. But don't go the other way and say, well, I'll just do as much as I think is due diligence, and I'll let the axe fall where it may. Because believe me, it'll fall right on you.
Okay, so this is a question that actually was added on to one of the statements you made earlier. So when an insurance company comes in to see or obtain records, you indicate it's fine to share. Can you tell me what kind of sharing? Are they allowed to have access to the EMR?
Well, they're only allowed to have access to the EMR for their own patients, right? So again, so when they go in, they're not allowed to look at just anybody. Right? So if the insurance company comes in, they're doing a chart check for their patients, not your whole EHR. The state may come in and do that, right? Which then that would be fine. But you remember you must have a policy on minimum necessary. So minimum necessary says you will only give access to what is appropriate for what the company, whoever this person is there doing. So if you don't have a minimum necessary policy, then you don't know that they only have access to the stuff. And if they say, oh, we need access to everything. No, you don't. You need access, and you stand up to them and you say, no, I will give you, what patients do you need to see that are yours? Do you have a list of the patients you want to go through? You don't just get to go through my database. No, that doesn't work that way. It doesn't work that way in healthcare. They only get access to the people that they need to see.
Okay, all right. So let's do, all right, regarding BA agreements, we have an agency in which we contract for CNAs. I was told that it is not covered under the BA agreement, but it is I'm sorry, I can't speak today, but it is if they are accessing our PHI, right? Question mark.
Okay, you have a BA with a company who's doing, what's CNA? I forgot.
I'm not sure what CNA, what they meant by, whoever asked that question, if you could tell us what you meant by CNA is. What you meant by CNAs. Okay, so let's use a different one while we're waiting for that designation.
I know what it means, and I just can't think of it, so I'm
bragging on it too. So what is the proper way to dispose of electronic data? For example, disposing old patient data in the EHR system would no longer be, who are no longer part of the practice.
Okay, so your state has requirements, right? HIPAA has requirements, right? And so the state, whatever your state law is with regards to purging, right? It may be 10 years, it may be 12 years, it may be 6 years, it may be 7. So first off, you're going to have to find out from your state how long do you have to keep medical records. It would probably behoove you to remove them to not paper, but to maybe to some, like a jump drive or something like that. Now again, when you remove stuff to the jump drive, you're going to encrypt that jump drive, right? And then you're going to store it. And if you ever, once the time has gone by that you can get rid of it, then you're going to do what? Most likely, you're going to destroy it. You're going to hammer it. You're going to shred it. You're going to do something to get rid of that, okay? Even though it's encrypted. You're going to destroy that device. Same thing as if you have a workstation and the hard drive goes bad, and you pull the hard drive out and you put a new one in. That hard drive is either going to get nails in it, or it's going to get hammered, or it's going to get shredded. And yeah, some people will say, well, what about if I want to reuse it? Yeah, I'm not really big on reusing. I mean, hard drives are so cheap now, it's just better if you destroy it. Because I've seen so many times, especially a while ago, that people would. Oh, another thing too is, well, remind me of this, but I've seen people that they've gone through and deleted the information off there, and somebody's got that hard drive and reinstalled the information. So it's just better if you have any drive within your medical entity that it comes out, just shred it, destroy it. Just, it's $30 to get something else, right? Another thing you all have to be aware of is if you have stand-up printers in your office that you've leased or you own, they have hard drives in them. And before you return them, you want to either have them DOD deleted, or take it out and put a new one in and destroy it. Because every time you've copied something, it's gone on that hard drive. And I've seen people, I saw one company got $800,000 fine because they returned their lease. It got leased out to somebody, some healthcare thing. They looked on the hard drive and there was all this thing, and they reported them. So if you've got those, you need to go look at them. And especially that means that printer company who has access to that printer, they're also a BA. Yeah, little sneaky stuff within your practice you have to be aware of. Okay, Mark.
Okay, by the way, so the question was a certified nursing assistant is a CNA.
Okay, so read the question one more time.
So regarding BA agreements, we have an agency in which we contract for certified nursing assistants. I was told that is not covered under the BA agreement, but it is if they are accessing our PHI, correct?
Right. Well, how can you have a certified nursing assistant and they're not they're not seeing patient information. How are they doing nursing? How the hell do they do nursing if they don't look at the chart?
So I would think, and this is kind of a thorny question, so is it the nurse that showed up, or is it the organization that sent you the nurse, or both that need to be BAs?
Well, in this case, normally what I have people do is when you end up with 1099s, right, I have most of our customers treat them as employees. And so I have them sign first. So since the nursing assistants or the CNA is not taking information back to the company, right? And so they would not be a BA, right? So they're providing the nurse. So then that makes you kind of responsible for this nurse. So what I usually have people do is sign a confidentiality agreement with the nurse and then train them on your HIPAA policies, procedures, and training. That way you're assured that that person will follow your HIPAA rules and regulations while they're dealing with your patients. So HIPAA confidentiality statement says that anything you see, hear, or touch while you're on site, you will not divulge to anybody, and that you understand all our HIPAA policies, procedures, and training. So you treat them as employees with regards to HIPAA training and confidentiality, and that way you can assure yourself that this person will follow the regulations, and if they don't, you're able to fire them on the spot because you will have a sanction policy that says that if you violate HIPAA federal regulation, you're gone. That's how you handle that.
All right, so let me give you a couple that are, they're two very similar questions, but when some foolish person emails you a spreadsheet full of PHI, what should be the proper procedure? Oh, and by the way, so the question is, after you mail them, telling them never to do that again, what's the correct way to dispose of that information?
Okay, so the first thing is, yes, you must admonish them, right? In actuality, it is a breach, especially if it was sent. Okay, another thing too. Well, I'm going to put this on hold for a second because things are just popping into my head left and right here. If you are sending information over your webmail, whether it's Google Mail or Yahoo Mail or whatever you're using, and you're sending information to insurance companies or patients or doctors, and they're not encrypted, every time you sent an email, you breached. You breached. You sent it over the open internet, open text. Anybody could pick it up. Anybody could see it. You breached that person's data. I want you to think about that, how many emails you've done. If you are doing that now, stop. Go get some company out there that will encrypt your email so that you can click a button and send it encrypted. Yeah, it brings up all sorts of other things with if a patient doesn't want to have it encrypted, can you send it? Yes, you can. You don't have to encrypt it to those people. But every place else you send it to, you should be sending your emails encrypted. Okay? That's the one thing that I see that just kills me all the time, that people are still sending stuff out by email that's not encrypted. Okay, going back to this. So when that person sent you this 500 person Excel spreadsheet, right? And they sent that to you, that's a major breach that needs to be reported to HHS. It's you know, and so you need to inform the person who sent it to you that they did breach, right? It's up to them to report to HHS. Now, so you tell them that you've done your job, and then what you need to do is get rid of that. You need to delete it completely off your systems. Make sure it's completely gone. Because you didn't receive it appropriately and you don't want it. Because those you know, and then the scary side is, you know, if that's one of your customers or your business associates that did that, obviously they're not obviously they're not following the HIPAA regulations, right?
Hey, Bob, one of the things that I think people will be generally interested in is that recent fine that was levied against for the access of PHI or the sharing of PHI, correct? The news radio. Shoot, you just wrote about it.
Yeah. So when you look at the fines, right, and they said, well, how can you fine somebody $2.2 million, right? How can you find when the ceiling is 1.5? I always wonder why people never ask that, right? How can this be 2.2 when I read that it is 1. That's 1.5 is the max? The reason why is they can do whatever they want. Once you fit into the section of willful neglect, which these people did, you now end up in the Inspector General's mercy of what it's going to be. So when you end up there, you end up being, it could be anything, right? So now, if you don't follow, this goes back to the person that said that, what happens if I just do a little bit of this and a little bit of that? You end up at their mercy. Their mercy is, what are you going, or how do they feel how much you did, right? Now in this case, where they were releasing information, guess what? They basically said, you're in willful neglect and here's your fine. You don't have any recourse. It's not like you've got all this giant recourse where you can have people, that they're going to. It's not like the NFL where you can go and go to the commissioner and get it reduced. You're not getting it reduced. That is your fine. And that's all based on their opinion of what you have in place. Now your lawyer, can argue all they want, but if you don't have that documentation to give to them, like I was talking about before, the policies, the procedures, the training, the this and that, you're going to end up with fines like that. So I just want everybody to know that, if you look at that article, what happens is when these people, you don't follow the regulations and you bury your head in the sand, that's the kind of fines you're going to get. And they don't care if you're a mom and pop. They'll do that to a mom and pop. What are you going to do? You're not going to be able to suffice. So.
All right, so let me give you, we are coming up on the hour, so I'm going to try to get to the questions, but let's try to get as many as we can before the hour runs out. I work at a hospital, and I'm the privacy officer. I have noticed that patients' medical records are being placed on the front desk, and anyone walking by can see the patient's names. I have talked with the compliance officer, and they said that it is not a HIPAA violation. I think it is. What are your thoughts?
I just explained that. HHS says it is. How about it sitting there and I just pick it up and start reading it? Remember, if you remember, I don't know how, in olden days of doctor's office, they used to have that little slot on the outside of the door and they'd put it up there. My dad would go out of the doctor's room and pick one up and start reading it because he was bored. Okay? So yeah, that is of course a breach, and of course that's not proper protocol. It should not be on the counters. You should be behind the counters, right? And so that's where you get into differentiators between what the compliancy officer says or the privacy officer or a thing and following the rules, right? So instead of impacting a few people, they'd rather just leave it out there. In my opinion, that's not proper. Right?
Hey, so a related question to that, actually, this was a different question that came in. Is it stated anywhere in HIPAA, high-tech security, or privacy rules that you need to perform a site or environmental assessment?
Yes. Yes, it is. That's the physical security audit. And you must have a physical security audit. And your physical security audit, basically what it is it looks at how are you handling paper, right? How are you handling your fax machines and your printers, right? What's happening to the paper? Is it going in a locked shredder box? Do you have alarm systems on the building? All of that is with regards to protecting the data, right? So all of these audits, right? The physical. So if you look at the rule, you must have an audit on administration, your policies and procedures, technical, the IT risk analysis device audit, and then physical. It says it, administrative, technical, physical. The physical audit looks at your whole organization. Are the screens turned properly, right? All of that stuff. Yeah, you have to have that audit, and you have to fix everything you find wrong.
Another relatively quick one is: do you need a BA agreement with your janitor if they clean medical records? If they clean a medical records office that has paper records?
This is great. So this goes back to my statement. Did you hire him to work with PHI? Absolutely not. So he gets a confidentiality agreement. You didn't hire him to work with PHI.
Hey, Bob, though,
yeah.
On that note, though, if he's an employee, though, he's considered an employee and has to be, it's not a BA agreement, though. I mean, the way this person wrote the question, it's a little, I'm not clear of the way the person wrote this question. If they were an employee, yes, right? I'm sorry. If they were not an employee, it would be a confidentiality agreement because that's not PHI. But if they were an employee, they should be attesting under the law as an employee.
Well, they would have done all their training. If they're an employee, they're going to do the training, which then they'll get a BA. So either way, there's no BA.
Yeah. Because, by the way, the reason I stated about it is I often hear people saying, and I think you see it too, well, I'm not going to have my entire staff go through training and attestation of policies and procedures. I'm just going to do the staff that I think relate to it, of which, a janitor still, if you think about it, there was was a $1 million fine last year for, was it Michigan University, where it was the janitor who had accidentally let malware in because she had checked his personal email. So do be careful. All right, we are 2 minutes out on the hour, so let me see if I can find another quick question. Does an affiliated physician who utilizes an EHR system from a hospital to treat and view results of patients in that hospital need a BAA? And I think that's an easy answer for you.
Whoa, one more time?
Okay, does an affiliated physician...
It sounds like an easy question to me.
I know.
Does an affiliated physician who utilizes an EHR from a hospital to treat and view results of the patient in that hospital need a business associate agreement?
Not a business associate agreement, right? Because if the affiliated doctor has rights at that hospital, right? He has right to look at those charts and look at the charts of his patients, right? No, he does not need a business associate agreement, right? Because that's why they go through that whole process of getting rights to the EHR system, right? Does he need confidentiality when he's there? Probably, but that's usually handled all through that process of him being accepted as a doctor of that hospital. Okay? So no, they do not. Absolutely no. Now, if you're sharing information, not even if you're sharing information, because you'd be sharing their information. So no.
Well, on that note, we are at the top of the hour.
Yes.
Another HIPAA chat has just gone by in a blur. We did not get to everybody's question, and so if we didn't get to your question, please feel free to email Bob at compliancygroup.com or Marc at compliancygroup.com or me, Carol at hightechanswers.com, and we will find a way to get you an answer. Bob, Marc, thank you again, and look forward to continuing the conversation in HIPAA chat in June. Thanks to everybody for attending, and have a good day.
Thank you all.
Thanks, Steve.
Thanks, Carol.
Bye.